Hi, my name is Lindsay Keating, and in this video today, I'll be performing my Foley catheter insertion checkup video. So a couple things I'm going to mention beforehand. I have entered the patient's room, I have performed my hand hygiene, I have introduced myself to the patient and explained the procedure I will be performing on them today. So now that I have done all of that, I'm going to place my patient in a supine position, and these two towels are going to represent my legs today. And so my patient will be in a supine position with the legs apart. So now I'm going to proceed to opening up my sterile kit. So I'm going to place the contents of my kit in between my patient's legs. And I'm going to take the outer part of the kit and make it a trash can. I'm going to make sure the opening of it is wide so I can easily throw away the things that I'm not going to need anymore. I'm going to place this next to my patient's hip. Okay, so now I'm going to proceed to be opening up my sterile kit, and I'm going to use it doing aseptic technique, being aware of my 1-inch border, and I'm going to open the inner flap that's facing me outward. Okay, so now that I have opened the contents of my kit, I'm going to don my sterile gloves. So now that I have donned my sterile gloves, I'm going to come over here to my kit, and I'm going to take out the waterproof bed liner first. And I'll place it under my patient's butt. So now that I have done that, I'm going to note that this is a fenestrated drape, and normally I would use this for a male patient, but today we're not going to be using it. So I'm going to place it off to the side. So now I'm going to take the contents of my kit out of the kit and place it closer to my patient onto the sterile field. So now that I have done that, I'm going to mention that I have this iodine solution, and I would pour it onto my cotton balls to have it to clean my patient's genitalias before I performed my catheter insertion, but today we're not going to use this, so I'm just going to place it off to the side. So now the first thing I'm going to do is I'm going to take out my lubricant, I'm going to uncap it in the trash, and I'm going to place some lubricant onto my tray. Okay, I'll throw the lubricant away. So now that I have placed my lubricant in my tray, the next step is to take my syringe that is with normal saline or water in it. I'm going to uncap this one as well, and I'm going to place it onto this port of my catheter. So now that I have done that, I'm going to take off the wrapping of my catheter, and I'm going to lube the end of my catheter. Lubricate the end of my catheter. So now what I'm going to do is lubricate the end of my catheter, and for a female I would do it 1 to 2 inches, and for a male I would do it 5 to 7 inches of lubrication, but for today I'm going to do it 1 to 2 inches for a female. So now that I have lubricated my catheter, I'm going to proceed to cleaning my patient's genitalia. So the first one I'm going to show you today is for a female, and normally my cotton balls will have iodine solution on them, but today we're not going to use the iodine solution, so I'm going to take my forceps and my cotton balls, and for a female patient, I would place my non-dominant hand, which it will be unsterile once I touch my patient's genitalias, and I would, for a female, open up her labia, and I'd take a cotton ball, and from top to bottom, I'd clean her farthest labia, throw the cotton ball away, and then use a new one, and do the nearest labia, top to bottom, throw the cotton ball away, and then do the middle from top to bottom where the urethra is, and throw that cotton ball away. So that's how I would do it for a female patient. And now that this hand is unsterile, I cannot touch anything that is sterile in my kit. Now I will show you how I would clean a male patient's genitalia. So for the same thing, I would take my forceps and my cotton balls with the iodine solution in them, and I would take my male's patient penis, and I clean the urethral opening and the glands of the penis. And I would repeat this 3 times with a different cotton ball each time. So this is the first time, the second time, and the third time. And I throw the cotton balls away each time. So now that I have cleaned my patient's genitalias, I'm going to take my catheter, and I'm going to prepare to insert the catheter on my patient, which would be a female patient for today since I lubricated it 1 to 2 inches. So that is the steps on my checkoff from numbers 5 through number 11. So now that I have performed the sterile part, all the part of the catheter is sterile, the checkoff. But since I've performed number 5 through 11, I'm going to go unsterile right now, just so I can show you the bifurcation and why that is important, how to take a urine sample from a patient who recently placed a catheter, and from a patient who had a catheter in for a couple hours to a day. And I have already showed you how I would clean a male and female patient, and I'm also going to show you how I would inflate and deflate a balloon on a male and female patient. So now I'm going to come over here, and I'm going to show you the bifurcation. So this is the bifurcation on a catheter, and this is important because if for a male patient, the catheter needs to be all the way in up into the bifurcation, and to make sure that the balloon is placed correctly. Just to make sure that the balloon is placed correctly and it's not in the urethra. So this is the bifurcation. So now I'm going to show you how I would place a stat lock onto the catheter. So this is how I would place a stat lock onto the catheter. The bifurcation right there, and I'd close it just like that. And then what I would do is I would take alcohol swab and clean the inner thigh of my patient and adhere this to the inner thigh of my patient. I'm going to go ahead and take this off since I have already shown you. We'll keep it on since I've already showed you how to place this. So now I'm going to show you how I would inflate and deflate a balloon on a female patient. So I have lubricated it 1 to 2 inches, and this hand is unsterile now, and this hand is sterile. So this is how I would show you to do it for a female patient. So I have already inserted my catheter and taken my non-dominant unsterile hand and stabilized the catheter. And now I'm going to inflate the balloon. So I'd inflate the balloon, and I'd hold pressure on my plunger and then remove it and then throw it away. That's for a female patient. And what I would normally do is I'd pull back on the catheter until I've met resistance, and then I would push the catheter a little bit more in, just so it doesn't have pressure on the neck of the bladder. And then that way I can go ahead and place my stat log and move on from there. So that is for a female patient. Now I'm going to, I'm unsterile now, and I'm going to show you how I would do it for a male patient, but I'm going to go ahead and deflate my balloon. And this is how I would deflate my balloon. And for a male and female patient, before I inserted the catheter, the patient is clean, the catheter is lubricated to the proper size for a male or female patient. Now for a male patient, I'm actually going to go ahead and remove this, just so y'all can see it. So for a male patient, my end of the catheter is lubricated 5 to 7 inches, and I would insert it all the way up until the bifurcation, and I would take my unsterile non-dominant hand and hold the catheter stable, and I'm going to go ahead and inflate my balloon. and I would hold pressure on the plunger and remove it and throw it away. And the same thing for me, I would pull back until I've met resistance and then push back in until, so that it doesn't put pressure on the neck of the bladder. And then the same thing with the stat lock. I'd place the stat lock on and adhese it, clean it, and adhese it to the patient. So now what I'm going to show you is how I would take a specimen from a patient who had an hour to a day had the catheter in. So what I would normally do is I would take an alcohol swab and I'd clean the top of this port. This is for a patient who has had the catheter for an hour to a day, and I'd clean this port and I would take a syringe and actually before I did all that, I would clamp my tubing and then I would clean it. And then I would take a syringe and draw up my urine that way. And for a patient who recently had a catheter placed, and this bag would be placed on the bed frame and not on the bed rails, and it would never go above the patient's bladder. So what I would normally do, say if it's hanging here, I would make sure that I have a towel down on the floor and a container just so in case any urine spills out. And I would take the cap of the drainage bag and I'd take it off. And I'd take the cap off of this. I'm gonna start that over. I'm gonna take the cap off of this and place it down. And then normally I would unclamp this and make sure it doesn't touch my sterile specimen cup, and I would retrieve the urine that way, clamp it back, put this back into my drainage bag, and then close this up. And then I would take a label and I'd label it, and then I would send it off to the lab. So that should complete my Foley catheter insertion. Thank you.